Good afternoon, everyone. I hope everyone has enjoyed their lunch and has regrouped. It's always dangerous when you meet after lunch, right? So, good afternoon. My name is Sean Joe. I am coming out of Washington University, and it's almost, I'm trying to be very reflective because I began with the Children's Defense Fund when I was an undergraduate student. And this is in 1991 in an effort called the Black Community Crusade for Children. I don't know if anybody remember that. And out of that, there was a Black Student Leadership Network. And I co-chaired that for quite some time. And so it's been many years. So, and to be back on Howard's campus. So I welcome you this afternoon to our conversation on the social determinants of health. The context of this discussion is very straightforward, and then I'll introduce our panelists. That the social determinants of health, that our young people are shaped by many factors, as you know. There's well-known documented health disparities, particularly for those in low-resource settings, impacting children of color, those in rural and in urban communities. These problems have been persistent, some would say even chronic. More recently, we begin to acknowledge that health is 60 to 70% of health has nothing to do with treatment, that they are these social determinants, and it's critically important that we understand that health operates in context, and it's critically important for us to advance strategies to address the context that does not facilitate good health and wellness, and our ability for our children to show up. Children and youth are subject to various rules and regulations in the spaces they occupy, as you know, including educational, political, and economic policies and systems. The social norms of place and space, the policies that institute those norms, the structural racism that conditions those norms, and of course climate change all has significant bearing on children's health. The panelists today will discuss why a holistic approach to care, training, and policy and advocacy are all needed to deliver the best solutions for youth and young people. Today we have, first let me say one of our panelists was in commute and is not able to join us due to an accident. She's okay, but will not be able to join us in time. But we have Dr. Hal Smith and Shana Bartley. Hal Smith with the National Urban League and Shana Bartley. For all you know, in the app is a full bio and description, so we want to really get to the conversation quickly. Please take a look at that so you can understand where we are. But this could be a very rich conversation, so we'll ask some questions, we'll come back, do some audience questions as well. I know how quickly it goes, and I've been in your seat earlier today. Just trying to get my hand up as well. But hopefully we'll have a very rich conversation. So let me start. So when I think about what policies or what can we do that's different, you have really two good experts who spend time on the ground as well at the national level. So we really want to begin with a simple question, all right? What emerging trends or innovations do you anticipate will shape the future of the social determinants of health for children and youth going forward? There's been a lot of conversation. Even the National Institutes of Health has moved in this direction, acknowledging structural racism is a determinant, and has done some new innovative work, issuing the Compass grants and other things to say that we need to bring that into the science of this work. But from your vantage point, again, what are the trends or innovations do you anticipate that will be coming out? And we can start with either person.
Sure. Good afternoon, everyone. So I think the most pressing set of innovations are likely to be around funding. This idea of braided funding, that we might be able to use the money that has already been allocated very differently, across barriers, across regulation. This includes data capturing, how we track the impact of investments, the kinds of things that families are facing, that children and young people are facing, and begin to understand how to develop policies and programs out of isolation. Right now, they're highly siloed and highly protected. You know, people who are in the legislature, state legislatures, city councils, Congress, are very protective of the kinds of investments that they're making and want them to see go in one direction. Even if we understand through research, through practical matters, that they would be best used in combination, there's someone protecting them to be used in isolation. So I think if we're able to overcome some of that and move towards a day where we're talking about all the forces and funding that is available for young people being used in tandem to have exponential effects and impacts, rather than I said I was going to serve 100 people, I served that 100 people, y'all leave me alone. That's all we're interested in. If we can go beyond, you know, kind of the outputs to outcomes that are available, because we've broken down silos that we know don't make any sense. But they're tied to funding, they're tied to institutions and agencies that have single visions, but that kind of interdisciplinary approach to funding, program design, policy, I think is one of the innovations I look forward to coming out of the last 3 or 4 years, because as the world has evolved, I'm hopeful that people's minds have been opened to see things quite differently than they would have, let's say, in January 2020, as recently as that.
Thank you. Shana?
Yeah, so I think building on Hal's point, you know, I have the benefit of working at an organization that has existed for nearly 100 years and has really spent a bulk of that time trying to implement a practice where we work in deep partnership with communities to advance solutions that they identify for the problems that are most pressing for them. And I think even as recently as 2020 and 2021, we saw really strong examples of what it means to put discipline behind that practice of really supporting increased leadership of communities in making determinations around how resources are spent and how they are allocated and how they are implemented. One example that comes to mind is we work deeply in a number of places, one of them being the state of Mississippi. And Mississippi, you know, faces a lot of challenges, particularly in its policy and political environment. But there's still a lot of really beautiful work that comes out of Mississippi. One of the examples was a really strong community-led health equity task force that basically was coordinated by community-based organizations to be in deep partnership with the state Department of Health. And Mississippi was the first state in the country to achieve vaccine parity across racial groups, because there were communities of color leaders working in deep partnership with each other to put pressure on the State Department of Health to ensure that communities were getting access to vaccines, and that there were kind of community-led efforts to not only educate the community about the benefits of the vaccine, but also to ensure that the resources coming from the state and the federal government were allocated to those communities as well. There were times during the implementation of the vaccine that Black communities were outpacing the uptake of the vaccine compared to other communities, which is incredible considering that we have some of the starkest health disparities in the state of Mississippi between Black and white populations. So that being one really crystal clear example of when you invest in community leadership in order for them to drive solutions and drive advocacy, you can achieve far better outcomes than are expected, but also serve as models for innovation in other places.
So as we invest, and thank you, as we invest in community leadership, one of the challenges there is sustainability. So both of you speak very clearly about intentionality. Intentionality in funding innovation to be able to work across silos, right? And to fully think about impact. And intentionality of having the capacity to be able to drive that from a community perspective so that you can reduce disparities. But sustainability is always a challenge. So when you're thinking about this work, innovations around sustainability and how, again, from your vantage point, that what direction we should encourage.
So I don't know that I would consider these innovations because they've been around so long, but they're, I think, newly rediscovered, to put it kindly. Some of this is around the kinds of community task force, community groups, community councils, however you might frame them, in that these are the longest standing, most durable institutions in a community. When I put my K-12 hat on and talk about ed policy, and people talk about the need for reform and innovation in education, I say yes, but you're investing in the wrong part of the system solely. So the average superintendency is about 3.5 years. The National Urban League and many other community-based organizations are deeply embedded for decades in these communities and see leaders, elected leaders, appointed leaders, leaders of other foundations, et cetera, come and go. But the investment in community, not just in agencies of the community, but in building, fostering, developing, deepening ties in a community are critically important. One of the things that has, I think, gained more prominence recently is the notion of community health navigators, community health workers. We similarly see that as an incredibly important investment, not just because it's a way for community voice and agency to be deepened in these kinds of processes, but to your point around sustainability and durability, the fact that they are of the community and recognized as community leaders, community resources, and continue to deepen those relationships by making themselves available to talk about vaccination, to talk about public health, to talk about public housing, the built environment, environmental justice, that these are legitimate experts on what it is to live in that community and be of that community as they try to build community. So an investment in the community and the institutions and the stakeholders has to be more than those people most typically identified as leaders, because the sustainability is not possible in the same ways when you focus on, the great woman or man, and then that person steps away, and there's no infrastructure, there's no connection that has been built behind them. And so you start all over again, or you start all over again at 10,000 feet, because the people at 1,000 feet, the people who are on the ground, they're continuing working. And it's only when the next leader comes in and can say, hey, I'd like to get involved in community, that their prominence rises again. But community is always being built, community is always being reinforced and reinvented, and thinking about the kinds of stakeholders you want there to be involved in your work. That's how you get to sustainability, and investing in them as much as you invest in any other single institutional leader.
Yes, I would just plus one that. And I would add, I think that that community leadership, that institutional memory, that community level buy-in, when you have folks that are kind of moving through leadership, moving through their careers, touching the work in different perspectives, are key towards pushing for sustainability. And I think that we have examples kind of through our work at the foundation where, for example, in our hometown of Battle Creek, Michigan, or starting for many years, but really kind of coming together at the beginning of 2013, we've always had a pretty strong focus on early childhood development as a key time period in which we know we can really support children and families to have long-term lasting impact. And the kind of a collection of folks from community-based organizations and the school district got together and said, we really need to create some coordination amongst the different types of early childhood programs, the school system, to ensure that all children are getting access to key supports as early as possible. So they established something called the Early Childhood Community Connections, where there was both the school district working in deep alignment and partnership with community-based organizations that were providing childcare, providing early education, as well as some of the support services to ensure that all newborns were getting access to home visiting, that there were these community-based play groups in places where families frequented, and that they were starting to find ways to connect when families were there, not only for the children's benefit, for the parents, whether it would be workforce development training, other kinds of things that were tied to child well-being, but were still really centered on the family's needs. That initial project started in 2013. I believe the full budget was a little under $5 or $6 million. We were in for just under $4 million. And within a few years, it was so successful that in order to achieve sustainability, folks were able to advocate and get additional support from the Michigan State Department of Education. So you take something that was incubated really tightly in the community, you start to have a proof of concept. You have folks that are reaping the benefits of the program, becoming champions for the program, and able to advocate for it at a much larger scale to then draw down necessary resources. So what we saw was, in 2013, about 16% of children were kindergarten ready in Battle Creek. Within 6 years, by 2019, before the pandemic, 40% of children were kindergarten ready, just by starting to build relationships in community. And my understanding is the investment from the state of Michigan came in some point towards the end of that 2019, 2020 time period. But it was like around the proof of what is possible with some philanthropic seed money, with some buy-in from the community, to demonstrate something really powerful and then advocate for its sustainability through the state, which we know government is the way that we scale things. They have the resources, they have the knowledge, they have the people.
Thank you both. So we talk about the social determinants of health, the National Academies of Engineering, Science, and Medicine issued a report about 2.5 years ago that really pushed to say social needs care is vital to healthcare, to try to encourage this connection, and raising the question about how does the Center for Medicaid Services and others really can reimburse for that, whether it's community health workers, and so again, to try to move the conversation in addition to many of the advocates like yourself. So when you look at this work in context, Hal, Dr. Smith,
Al's fine.
what do you see as the most pressing challenge in this arena today, and what strategies do you suggest can address those challenges?
So I think the most pressing challenge is we are stubborn in holding on to frames that no longer work for us because we understand them rather than they actually serve us. So one of the things that we have seen since March 2020, when the COVID crisis first began, is a quick pivot that everyone had to do because you needed to do this. You needed to get food out to people. People were isolated. You needed to help people understand what was going on and deal with the trauma in their lives because people were dying and were sick, and all these things that were made possible because we stopped responding and were proactive in saying, this is what we know human beings need to survive and thrive. As the crisis has abated or changed form, we have quickly retreated back to notions of policy and program and support that are blind to what we've learned over the last 3 years, right? So I was in a meeting maybe 6 weeks ago where folks were talking about student lunch debt and what we should do about it. And we were there for 2 or 3 hours. It's like, the answer is simple, there shouldn't be any, right? Like, we know that young people and children do well when they're not hungry. So why are we having a conversation about how then do we reduce the debt that they owe to the school system, which is there to provide support and education to them? But it was such a quick retreat, right? Like, it wasn't that it took years for us to say, well, this didn't work, making sure every child had 3 square meals a day served at school or in other settings was no longer the priority. The priority was, hey, we've had this opportunity to provide free lunch, Title I, to young people and families. How do we reduce the cost and burden of that? It's like, no. How do you invest so that that's off the table? That's no longer a consideration for us. We don't have to talk about that. We don't have to talk about the provision of school nurses and counselors using, ARPA funds and ESSER funds. We're about to hit the fiscal cliff. We know that it works. We know that it's meaningful. Let's figure out how to pay for it. But we've retreated back to 2019 positions where none of the connections we were able to make over the last 3 years that we know made a difference. People are alive because we made a difference. That's the biggest challenge to me, that we seem to have not learned anything or are more comfortable in the old space than we are in this new space.
And I wonder if I can translate this to my mother, 75 years old, because I'm trying to push the point in just a little bit. We had the pandemic. We made executive decisions.
Mm-hmm.
Can I say that word?
Yes.
All right. Where we saw the insight, we did things. We didn't ask how much red tape and process.
Right.
Is this what?
That's exactly it. Yes.
And we lost that insight.
Yes. And immediately went back to, well, I don't know that the regulations are going to allow. We'll change the regulations. Well, I don't know how that's possible. Right? And so as an advocate, as a policy person, researcher, program person, it seems to me that all of those conversations that were deep conversations and quick conversations, as you say, it's like we have to overcome this because we have something in front of us now. Right? The child poverty rate is in front of us now. The infant mortality rate is in front of us now. This does not require blue ribbon panels. We know what works, and we know how to make that investment. We have to have the will to overcome the inertia.
Because children are still dying.
Absolutely.
Okay. From the National Urban League perspective, how does the Urban League is moving in this direction?
So, it's interesting. My background is in education and community education at that. I had not heard of the social determinants of health until we brought on someone who's very experienced in public health, and she explained it to me. I said, that makes perfect sense. But I would argue there are social determinants of education and social determinants of housing. And the social determinants frame was very, very important for us. What it's meant is that we as leaders at the national office have to go out to our affiliates across 36 states and Washington, D.C., and learn about how this work is done in real life. And what can we do policy-wise to amplify it? What can we do research-wise to amplify it? Educational justice, environmental justice, public health justice, green justice, all of it is the same. But we ourselves were attacking it in a silo mentality because that was our expertise, that's where the money was flowing, that's how the frame started. So 2 years ago, we really began knocking down those things. We have probably 6 different programs that serve young people. None of them were talking to each other, right? It was, well, these are formerly incarcerated young people, and these are young people who are career ready, and these are young people who are going to college. And 2 years ago, we said, well, we're just talking about young people. And can we start from there and give them a sense of the kinds of opportunities that are available? Career ladders, readiness became our code word, right? We've long held that readiness is the ability to go into your first year of college or career absent the need for remediation. That was it. That was fairly simple. But we could not apply it ourselves to talk about young people and children in a comprehensive and connected way. We're now able to do that. We're talking with our housing folks around the built environment and the need for green spaces and access to clean air and water. Prior to that, we were probably driven by the need for black home ownership only, right? Or predominantly, let's say. But if that's the case, then can we connect that to the ability to talk about health in those ways, health as housing, housing as health. Those kinds of connections that we saw made on the ground make it much easier to have the conversation ourselves,
Right.
with policymakers in our advocacy role, with researchers in our research role, but most importantly, to drive these conversations in different ways where we can connect not only our expertise, but connect what's going on in any given community, what's going on in other communities.
Thank you.
And lose those as lessons.
Thank you. Shana, similarly, things that you and Kellogg are doing, what are those examples of successful approaches or initiatives that you would like to highlight that addresses the social determinants of health for children and youth? And can they be duplicated across communities?
I certainly believe they can. I think the example of the early childhood community connections is a great one, and actually something that we know is happening in communities across the country. It's I think we were talking about this earlier. It's like we know the solutions. Are we investing in them appropriately? Are we seeking to scale them? Are we adapting them appropriately for people's different cultures and traditions? These are kind of the bigger questions that I think that we're sitting with and trying to find new ways of investing in and coming alongside partners on the ground in communities to think about what does it take to achieve scale. And quite frankly, not everything is designed to or needs to achieve a certain level of scale. Some things do need to be tailored and focused in communities. I don't know if this is working out. And sometimes, those homegrown solutions are designed to be held by people in their homes. There's other ways that we, quite frankly, can approach how we distribute resources and what we expect in terms of reporting and outputs and things like that, where we can be more focused on how are people changing the ways in which they work and less about, how many widgets they're producing or how many meetings they're holding, and instead being like, are the kids better off? Are the families better off? So I think, in addition to kind of some of the examples shared previously, something that's really live right now that we've been working on is a deeper partnership between our foundation and Battle Creek Public Schools. What we know is that kids need to be healthy in order to learn, and it's really hard to learn when you're not healthy. So what are the ways, should I switch? Thank you. No worries. Is this one? It's on. Okay. Sorry about that. So right now we have a partnership where it's a partnership between Battle Creek Public Schools and one of our community health systems, Grace Health, where they are bringing in another solution that we know exists in other communities, but they are bringing in health services into schools. They're able to serve more children, meeting them where they are, ensuring that they're getting access to all those critical vaccinations, well child visits. They're bringing in dental as a component, and they're currently in discussions around how to procure more mental health services directly at school. So these are examples that we know work, right? You go to where people are, you connect them with providers that are in the communities in which they live, and you kind of take on this no wrong door approach where whether we see you at school, we see you at the clinic, wherever we are going to see you, just know that we'll take care of you. Mm-hmm. And I think that, the harder parts are the parts that we know how to do these things. We know how to finance these things. It's just, again, to what you raised earlier, do we have the will to do it? Philanthropy can definitely come in and supplement and augment and do all the buzz things that we talk about, pilots and seed funding and all these things. But at the end of the day, when it comes to sustainability, it is building the political will to continue those kinds of investments and continue to invest in things that maybe don't fit everybody's mind of like, should kids be getting healthcare at school? Well, why shouldn't they be getting healthcare at school? What's the reason not to do it? So I think that there's numerous examples that we have through our work, this being kind of one that's really live and we're continuing to learn from.
Thank you. Well, one of the key things that determines health is housing. Mm-hmm. And there's a lot of conversation, I say it's a growing conversation, about housing and health and the well-being of children and youth. What should young leaders take away or advocate for regarding stable and safe places to live? What are you seeing in terms of what's working across the country around housing and health?
Yeah, I think raising it, first of all, is an important frame because they're often disconnected. But I think what we've seen is the push for Black home ownership, the push for increases in investment in public housing and low and moderate income housing is incredibly important, simply because we understand the ways in which having a stable and secure home is important. We often talk about whether something is a binary, right? So that you have a home or you don't. But we also miss the nuances of churn, of families that have homes but move 5, 6, 7 times a year, right? That's also part of this. And if you're able to build up a public health response that acknowledges this, an educational response that acknowledges that you're going to have this, whether it's through, migrant farming, or people can't get a down payment together, or they can't make rent this month, so they have to move to the next place. These are known factors in the lives of the people that we serve, and housing as a way to address this is really important. It's people's most expensive expense. It's the way in which we can ground other supports, because, geolocated, that everybody in this zip code or census tract has an opportunity to earn a living wage, has an opportunity to connect to housing that is safe and stable, not the current set of public housing that is available, which almost no one would defend the status and the state that they're in. But we can do things quite differently if we know that folks have a home, and then use that as a base to understand how else we might support them. We also spend a great deal of time talking about this as a question of economic mobility, that the more people are able not to make sense of their finances, like in a financial literacy kind of way, but understand how these resources can exponentially build upon each other to build a more stable, more healthful life, is an important step. So we don't talk about this as, well, everybody needs to do this 30-day financial literacy course. No, we talk about home ownership, we talk about rental rights, we talk about helping people meet their bills with high energy costs in ways that help them understand how to connect that in their own lives, and then help policymakers make those same connections back. Because we know a great deal about what positive impact stable, clean, healthful housing makes on the lives of people.
Thank you. Any comments? Okay. So there's a lot of learning. How can we ensure the next generation of policy priorities reflect our learning going forward? We're moving not just from a discussion of population health to population impact. There's a difference. All right? There's a lot of discussions about population health, but not population level impact, which requires a different level of intentionality and investment and learning. So any thoughts, suggestions around policy priorities that can reflect such a learning, that can lead us to population level impact? So let me borrow from a neighboring governor. Data informed and heart led. All right, I think this is one of your governors, Westmore. That's his leadership style. So again, population level impact. Right? Data informed, heart led.
Right.
But can we see the difference? Whether it's in infant mortality, maternal death, pick any one of these health disparities, population level impact.
I think that's right, and I think it's not well understood, the population level impact part of it. Part of this is going to be the public narrative aspect of this, to get people to understand how to talk about these things in ways that make those connections, but also allow them to continue to innovate and think about how things that may have worked in one community can inform the next community, but doesn't need to be 100% fidelity, right? So for me, the data informed is very important, but there are limitations to that because we aren't always asking the right set of questions. And the right solutions aren't always funded, not just by the foundations, but by government to understand the impact of X because it's not well known or understood. So we keep doubling and tripling down on the same kinds of frames because they're data informed. We have a lot of data about this. They've been through the rigors of academic journals, et cetera. But there may be solutions that haven't quite got that attention yet, which we can think about differently because the data in this community shows that it works. The second part of it for me is I no longer talk about policy outcomes in scale in quite the same ways. I think there are natural limitations to every model to scale. And 100% fidelity of that, right? Some of it is the people around the table, the history together, the context of a particular area, whatever, there are natural limitations on that. I do think, however, you can scale outcomes. That if you work in a certain way, a way that focuses on population level impacts and outcomes, you can have similar success to your neighbor, but it doesn't require you to do everything they did in exactly the same way. And so having a focus on population level impacts and outcomes, for me, is a narrative question because we have to get people to think in that way and use that language instead of, well, we're gonna run this pilot, we're gonna learn what happened to these 50 kids, and then extrapolate what could happen to 1,000 and congratulate ourselves. Rather than we aimed at 10,000 and we know what it's going to take to get those things. I've been running around for a few years trying to get the language to say this, but I really hope that one day we're able to talk about things not just in complexity, but in the raw numbers of impacts, right? So we hear they had a 5% increase in this and a 5% increase in that. How many people is that? Right? It's like and if we're really serious, we talk about that. Said, well, there were 100,000 people at risk, and we saw, a slight increase. Okay, that's an important increase, but what happened to the rest of them?
Correct.
Right? What was the impact of our policy work on the rest of them?
Right.
Is a question that I hope we're able to get to as we shift the narrative to population level kinds of impacts.
Shana?
Yeah, I think building on that, and I think what we're learning is it's not just what you do, it's how you do it. What is the process? Who is engaged? Who's leading those decision-making tables? Who's setting the table? Who's invited? Who's not? So, when we think about what all the things we've learned in the last incredibly difficult 3 years, and we think about how we take all of that learning and fundamentally shift the terrain in which we're working on, we have to think about the how. And I think the foundation is committed to really investigating and interrogating the how. We know that our community partners are innovating every day. That's why we're in partnership. That's not, the questions are not who's doing it and what's going on, it's how come we're not doing more of it? What are the barriers to doing more? How can we address those barriers? So I think just building on your points, it's so much more of having real, tangible, actionable conversations around the how, so that the what is not only better, but it's durable, it's sustainable, and we can start to see population impact because we know that we're reaching to communities who are historically disenfranchised, who are intentionally marginalized to drive solutions around long-term problems, and that our solutions are also designed to be responsive to historic injustice and historic harm, and is also respectful of culture and tradition that is essential for actually involving people in things like their healthcare, in their education, in their workforce pursuits. So I think if I were to summarize it, it's really starting to get down to the how and spending more time thinking about that.
Thank you. I appreciate you both. Let's open up the dialogue, and we have a lot of talent and experience in this room. So we want to begin to take some questions from the audience.
Hi, good afternoon. My name's Kuna, and I'm here with Parents as Teachers, an early childhood home visiting model. And Dr. Smith, I was reflecting on what you said about shifting our conversations and not reverting back to 2019 in particular. And I've been thinking a lot about how we reduced child poverty by half temporarily through the American Rescue Plan Act. And it's my opinion that that law wasn't actually enacted to reduce child poverty in half, right? But that was one of the outcomes. And the culture around the way that we address a lot of the programs that did very significant short-term work through ARP, I think is where I get caught up. So how do you really work to change the culture around the way that we take care of our young people and our families, especially in that context of not wanting to revert back, but operating in this kind of short-term, temporary, not really intended to change our culture kind of environment?
I mean, I think that's a great example. In many ways, I think the conversation has to include unintended, very, very positive outcomes, and not just be limited to this is how much it costs, because we're not only fighting for a reinvestment in things that we know that work, but we're also fighting against this relatively new tendency to create distrust in public institutions, collective actions. This includes the book banning. This includes all the stuff that we're fighting and playing whack-a-mole with all across the country. But this idea, again, research has demonstrated that we cut child poverty by 50, 60% in 2 years. Unassailable. Everybody acknowledges that. They also acknowledge it costs a fair amount of money. Instead of the conversation about how do we pay for that and have those kinds of impacts across the country, again, the conversation is about, well, where was there waste? And how do we have a conversation about this when we're in the middle without triggering inflation? And all these things that are important but aren't central to this particular argument, right? It wasn't that we had the will to cut child poverty in half, because that, as you say, that was not the intended consequence or aim of that, but it was an outcome of doing things quite differently and investing in levels that were unprecedented, but probably still were short of what's necessary, right? So in my mind, we've started having conversations with folks about what would it take to address the remainder, the 40%. Assuming the model we had going 2 years ago continued, what would it take to achieve 100% reduction in child poverty? That kind of, where we presume that the outcome we have is the new floor, is part of what I hope we're able to do, and not just look at this as a blip or an aberration, but to say we made progress, this is the new floor. It's unacceptable to have a level any lower than this. We're ways away from that in many of our policy conversations, unfortunately.
Can I add on to that? I think this is a really great example of why the how is actually really important. Because what we were able to do was reduce child poverty in half, but how we did it was using the tax code, right, using tax credits. These aren't things we don't know how to do, but there's not political will, especially amongst certain people who hold power, to see the tax code used to help everyday people pay their bills and take care of their kids. And so there's a terrain question of, if we have proven that we have tools and know-how and resources to do something, and yes, it wasn't 100%, but cutting it in half is pretty good, and we're utilizing a tool, that is the people's money. Tax credits are the people's money, and you're giving it back to the people, and they're doing really good things with it. Why wouldn't we then make it permanent? Why wouldn't, and what was the other learning? We gave people cash every month. You give people cash, they can take care of their bills. They can take care of things. So there's some really important how questions in there that I just don't want to lose sight of in the conversation as well.
And we have a time for 2 more questions. In the spirit of this, I'm going to give a commentary here. I have that privilege right now. Basically, given this is the Children's Defense Fund, there was a de facto spiritual commitment to the humanity of more people, that was motivated by the needs of a select group that they wanted to serve. Mm-hmm. Another way is that it was an effort to help Americans, but you couldn't help some Americans. You had to help more Americans. And I find that that's really interesting when we think about which will was motivated to say those who were deserving of help. Well, we have a question at the back, sir.
How you doing? Joe Scantlebury, CEO of Living Cities. Good to see y'all. Really proud of this conversation, but I want to just cut right to the chase. How you raised the issue of silo busting within our organizations, within our regimes, within our administrations. And then Sean just lifted up the issue of the specter of death forcing us to actually see our humanity. I'm curious, what are the tools that you all see that can help us break through the silos? Because braided funding is not a new thing.
No.
It's just never been done consistently well, or even with the political will to sustain it. So I'm just curious, what tools? And Shana, good to see you and hear your voice. Go ahead. So just bring it.
Sure. I think one of the things I was thinking about in preparation for this conversation was something that actually happened in one of our named places in New Mexico last year, where residents went to the ballot and voted for a constitutional amendment that guaranteed all children the right to early childhood education. And the reason why that is so salient in my mind when we think about population level impact or scaling solutions that might work is that when you give someone a right to something, it fundamentally changes the terrain in which you have conversations. Because it's no longer a question of how do we have access to things. It's like, people have a right to access this, how are you gonna build it? Right. How are you gonna ensure that there's a workforce there to both administer the educational services and the wraparound that will certainly be needed around it? How are you ensuring that it is culturally responsive, that it is available in all languages that are reflective in the population? So when we are thinking about, how do we start to change the conversation, it is how do we change the political terrain in which we have these discussions, the policy terrain in which we have these discussions. Because once someone has a right to something, it's no longer of, well, we only have this much to serve some, or it needs to be means tested, or all these things that we know don't work and don't actually move us closer to our objectives of seeing all children thrive. We change the conversation in which we can get spicy and have conversations around, like, they have a right. What does that mean? What's the role of the court in enforcement? What's the role of the government agencies in providing services? What's the ways in which we support community-based organizations to scale practices that work? So that for me is like one thing that is very salient in conversations like this, where we're like, yes, it's certainly about financing, but how do we change the terrain in which we have the discussion and get to the next set of questions that we really know are going to get kids what they need?
Yeah, quickly, I think all of that is exactly right. The other part I would add is we have a sense now of the ways in which a different approach made a difference in the lives of communities and people. it is incumbent upon us as advocates, as researchers, to have multidimensional conversations ourselves, right? Because some of it, to some of my colleagues, is impossible to imagine. Braided approaches, been around forever, but it's one of those that are understood as politically not feasible. And so we've stopped fighting for things because we've said, well, we can't get it, right? Or the change can only be measured in increments. And I think getting out of our own way and allowing the data, the research, the need, the things that have worked in community to speak for themselves and work backwards. How do we get this to be the new normal? How do we get this so people have to defend the ability to separate this out as opposed to putting it together? We're a ways away from that. And I hope that conversations like this can move us forward.
One last quick question, and then we'll close.
Testing. Okay.
Yep.
My name is Jasmine, and I'm an elevator trainer for Freedom Schools, and I want to thank you all for having this conversation. You asked the question of how I work in communities with Freedom Schools, and I just wholeheartedly believe that having a Freedom School in all these communities is the how. It it addresses all these issues that we're talking about in the room. We can't physically put money in their pockets, but we can lead them to resources and empower the children. But my question is, as an educator myself, you said something about we're holding on to old things and expecting a new result. Education, I've been in education for a while. We're still using tactics from 100 years ago, and it's not working. And how do you envision the education system in the future, in your opinion?
Sure. So first and foremost, I talk about, and the National Urban League talks about, education and schooling as two different things, right? We've conflated what an education can do for someone with what a school can do for someone, a brick and mortar school. So in that way, we no longer simply talk about accountability as being the government closing down schools and doing this. We said, well, what is the community going to be responsible for in the education and training and development of its young people? Where are the museums going to come in? Where are the social service agencies going to come in? Schools are not going to do this alone. So we talk about the multiple systems at play in a young person's life. The school system is one of them. The educational system has far more members than the school system. And if we can't activate those education people, the larger set of education people, to see themselves in that work, after school, out of school time, sports and recreation, everyone on the thriving and well-being of young people, but keep reducing it to what goes on in that brick and mortar building we call school between 7 and 3, we will never be able to get where we want to go.
And with that, let me say this. First of all, I want to thank you for being here with us to be part of this conversation on the social determinants of children's health and well-being. I want to thank our panelists, Dr. Smith and Shana Bartley from the National Urban League, and again from Kellogg Foundation. You heard a few things, and I'm going to try to wrap it up. It does not represent their summary. The word was audacious. You got to be recklessly abandoning the old frameworks, move into these social innovative frameworks. The word there is called audacious. So you want audacious steps to move forward. What you get in terms of child health outcomes is based on what your community is organized to do. So how you do this is going to be critically important. How you organize your community determines what sort of outcomes you get. So you're hearing a lot to say you have to be intentional about how you organize to get the health outcomes that you need. And again, you want a budget that is impactful. So when you think about this work, take the ethical stance. Do not expect more where you don't give more in your budget. And make sure you pay attention to how we fund and invest in these things that breaks across the silos, that fully leverages the community's capacity. So with that, I say thank you and have a great rest of your day.
Thank you.